Friday to you. Welcome to the Freak Show. Well, it's Free Advice Friday once again, and I'm with this good fella here, and he is going to be answering all the questions you submitted online, and we're going to have a good old time.
You're going to have a good time.
I'm going to have a good time.
I really don't enjoy this very much.
Did you have a good 4th of July?
That was awesome.
No, it wasn't. I was with you, and you didn't seem like it was awesome. He took a nap like midday with Landry. You're both in there with your mouths open, snoring.
Why are you going to bring my business into that?
I don't know. Because I think the world wants to know.
No, they really don't.
You guys let us know if you don't want to know, but I have a feeling that you do. But you did have fun.
We had a rough night, Landry and I.
Oh, yeah?
Yeah.
Why is that?
Well, she kicked the hell out of me all night long.
Really?
I was kicked out of bed at 2 o'clock in the morning by her.
Oh, that's mean.
Yeah, so all the rest of the night I'm in a recliner in the living room sleeping, trying to sleep, listening to the kids crying and everything. So, no.
If you guys don't know Landry by now, she is probably, well, you're her favorite anyway.
She's my favorite.
That's his grandfather.
Without a doubt.
Yeah.
Yeah, I mean, grandparents are entitled one. They're like, oh no, we don't, we love them all equally. We're partial.
That's
I mean, when you see Landry and she comes running at me, she looks like E.T., she's going, like this, and this is what she does, and she comes running at me, so, I mean,
breaks your heart.
It does, it does.
Well, speaking of breaking your heart, I have a question about aspirin and heart attacks. Was that a good segue?
Yeah, it was perfect. That was a good lead-in.
So your first question for the day is about aspirin and heart attacks. Everybody says that people should be taking aspirin regularly to avoid heart attacks. If you think you're having a heart attack, you should take aspirin. What's the deal with that?
Number one drug, if you're on a plane, and I have an armamentarium of drugs, 30,000 feet up in the air, and I can give you any medicine in the world for a heart attack, I would reach for an aspirin.
Okay.
All the drugs I've had that are over the counter or even by prescription for the most part, not including drugs you can get in the hospital, the stuff you put in the vein, stuff like that. But short of that, number one drug. That's all I need.
Wow.
If I was on a desert island, that's what I would want. Aspirin.
Really?
Yeah, for heart disease. Interesting enough, you don't really have to take the full aspirin, the 325 milligrams, just the baby aspirin, the St. Joseph little pink baby aspirin. It can be coated, uncoated, I really don't care. But it does a thing called dephosphorylates platelets, which makes them less sticky. Platelets are like a cell almost, but it's really not. It's more like a piece of a cell that floats around your bloodstream, and when you get cut, they aggregate and they stick and they want to form a clot. Well, when you take a baby aspirin, it dephosphorylates your platelets, which means makes them less sticky.
Thinning out?
Not so much thin out, makes them less sticky.
Oh.
So they don't want to adhere to an area that's inflamed or rough, like a plaque that's rupturing in your heart vessels. So no, it's an awesome drug. And a baby aspirin will actually affect your platelets for 3 days.
Oh, okay, cool.
So, but I would recommend taking it every day.
Every day.
And it makes them how much less sticky? Probably about 50%.
Well, that's cool.
Yeah, so awesome drug. Actually, there was a good
It's like the goo gone for your heart.
It kind of is. And actually, it was a question that was asked to me 35, 40 years ago by a cardiologist in Kansas City. I actually still remember his name. His name was Paul Becker. I'm sure he's retired now, but he was at Research Medical Center. He said the same thing back then, and it's still true to this day.
Wow.
Baby aspirin, desert island. Yeah, that's what he asked
and
me.
There's no long.
He goes, Brian, of all drugs, you were having a heart attack on a desert island. What would you want? And I got the question wrong.
What'd you say?
I said
nitroglycerin
or yeah.
That's what I've always
nitroglycerin or something. I don't know, but I didn't guess aspirin. I was like, wow. And then he explained to me along those lines, but it's been true ever since.
Wow.
That has never changed, but only a baby aspirin. You don't need the 325 milligrams. Taking more aspirin is not going to help you. Won't do any more good than a St. Joseph's baby aspirin.
There you go.
So that's the answer to the...
All right, and there's no long-term damage to any organs if you take...
Well, not directly. I mean, it doesn't damage your kidneys per se like the non-steroidals do. It doesn't really bother the liver. It's a relatively low dose, but it can cause gastric ulcers. It's been linked to gastric ulcer disease. So, I mean, if you start seeing some dark black stools or blood in your stool, that always needs to be checked. So, but other than that, I mean, it's relatively innocuous, a baby aspirin. I mean, it really ain't gonna do anything. And of course, in the elderly, we have to worry about it because when you fall and you hit your head, you can bleed more in your brain, stuff like that. I mean, there's risk and benefits, but I think by far the benefits outweigh the risk in this particular situation with a baby aspirin.
Cool. So it's a pretty powerful little baby.
Yes. And it's easy to reverse in the emergency room. If somebody comes in, they're bleeding because of an aspirin. The only thing we have to do is give them platelets, fresh frozen platelets, and it's completely reversed.
Fresh frozen platelets.
Yes, fresh frozen platelets, or fresh frozen plasma platelets. Just platelet packs is what they call it.
So if you're out there donating plasma, congratulations.
Yeah.
You're saving lives of the people who eat baby aspirin.
Yep. And so it's an easy to reverse, great life-saving drug.
Very, very cool. All right, well, that's pretty awesome.
Actually, I should be taking it. You don't know the truth.
Well, better get on it.
I don't take very good care of myself, obviously.
That's kind of like.
And what do you care?
That's kind of
like. You
didn't
visit me when I'm in the ICU.
Oh, whatever.
You don't.
Yes, I did.
You're soulless, is what you are.
How many times is he gonna bring this up?
You're the one that started it.
It's like once a week he's got to jab at me, and once a week I gotta remind him I was there. You were just drugged out, and you don't remember it on whatever they gave you off.
Well, it doesn't count then. I don't remember.
Oh,
next question.
Okay, next question. Staph infections. We want to know, what is the deal with staph infections?
You know, a lot of people, we all have staph on our skin. You have staph on your skin, I have staph on my skin. Yeah. And over the years, because of all the drugs we use, it's become more resistant to antibiotics. And so a lot of people make a big deal about MRSA, methicillin-resistant staph, what they call it MRSA. And it's just more resistant to antibiotics. It's interesting, though, this is just my observation, typically those types of infections from resistant staph are usually, now I'm going to say usually, of course there's outlying infections that have crazy things, you know, abscesses, burns, stuff like that, so it doesn't apply. But they're usually not as severe as the normal unresistant staph infections. And I've noticed that over the years. So just because you have a staph infection, impetigo, abscesses, it's usually not that big of a deal. So, you know, if you go to Walmart, and I shouldn't say this, shopping carts in general, let's put it that way, they're everywhere. Yeah. You know, Home Depot, Walmart, Dollar General, wherever you go. If you were to swab that handle, it would freak you. Oh, I bet. And you think that little pump hand sanitizer you're doing, the wipes you're doing on it, is going to do any good? It is not. That's a complete waste. Yeah. So don't let your babies chew on those handles. Short of putting chlorine, bleach on those handles, you're not killing anything.
Ooh. So those wipes they give you,
that's just
to make you feel good.
That's all they do. Yeah.
What's up with them swabbing the inside of your nose for staph?
Well, a lot of people are what they call staph carriers, and it's on your skin, but you use soap and water. In other words, if I were to take Lysol and squirt it on your arms and rub them down, you wouldn't have any staph. But then, you know, you sneeze or something, you blow staph out of your nose, it lands on your arms, boom, it's growing again. But your nasal cavity actually can harbor staph. Oh. So they'll swab your nose to see if this particular organism is thriving there.
Why and what do they do if it is?
I don't know.
Like,
if you're resistant to everything, there's not a whole lot they can do. Other than tell you you're a staph MRSA carrier.
They're just not going to do anything.
No. No.
So it's a little bit of a strange thing to do then, isn't it?
Well, you don't want to be a staph carrier and be around somebody that's immunocompromised, like bone marrow transplant, undergoing chemotherapy and stuff like that.
So they just need to know.
Yeah, and honestly, you should assume everybody that comes to visit a person like that in the hospital is a carrier. Yeah. Then you wouldn't have to worry about it.
Because it's more likely that they are.
Yes, more likely than not. In this day and age, yes.
Okay.
Yeah. You have methicillin-resistant staph on you, I have it on me, it's on everything. Wow. You go to a nursing home, it is rampant.
That's scary.
it is. It is. I would say, and
Because they're all compromised.
Yeah, I'm going to float this out there, but I would bet anywhere from 85 to 99% of all patients in a nursing home have it.
Ugh,
It's everywhere, and you can't stop it.
that's scary.
Yeah, you're not going to stop it.
Oh,
Ever.
it sounds like The Langoliers. Do you remember that movie?
No.
Wasn't it Stephen King or something?
No.
Okay.
No,
Well, if you guys remember, it's like those little chomping things that eat the whole
Oh,
world.
Lord Jesus. And you wonder why we call this the freak show. Freak.
Well, okay, so if you have a really bad staph infection,
They can be treated.
but don't lose your mind, but just go get it handled, right?
Yeah. It's staph, strep. I mean, they're just infections.
Okay.
They're typically in children and normal adults. It happens. They're fine.
Okay. All
So-
right. Well, then that was that one.
They make a bigger deal out of it than what it is.
Yeah. I remember when I was in high school, it was a big deal.
Yeah,
There was staph everywhere.
Oh my God, there is. I mean,
Yeah.
you go to those mats on the gym floor.
Yeah.
Jesus Christ, on Friday. I mean, it would just covered, and you probably see it growing on there. I mean,
Yeah.
Yeah. I mean, just the smell of the gymnasium just about nauseates me anyway.
Yeah.
So, but yeah, it's everywhere in the gym.
Yeah. Well, it was always really scary. I was like, we're all going to get staph. Okay, your last question today. Are you ready for this?
Yes.
This question is about yellow toenails. What is that about? What do you do about it? What's the cause? Yellow toenails.
They're typically fungal infections in the toenail, and they're
Okay.
really tough. And I think we covered this maybe once before. I don't know if we ever did or not. But your fingernails grow out in about 3 months. In 3 months, in other words, I have a fingernail here that I busted. No, I'm showing them. I'm showing them my fingernail here that I got hammered
That
on a board.
just worked out great for you, didn't it? That's the one.
What are you talking about? I'm trying to explain something.
Okay,
Can you be
I'll
quiet?
let you finish.
So I
I'm
got
gonna
this.
let you finish, but I'm just kidding.
You're losing me here.
Well, it's a comedy.
Anyhow, this is a medical situation. So this fingernail, I got nailed by a board in my fingernail by my beloved brother-in-law, and so it bled underneath my nail. This is going to take 3 months for it to grow out.
Yeah.
And what causes your fingernails to grow, and why they grow faster than your toenails,
Yeah.
is tapping on them. So tapping on your nails
Really?
causes them to grow faster. Yeah. So that's why they grow in 3 months. You have a complete nail will grow out. The
So you've been tapping that one a lot.
Probably. In this room anyway. So, but your toenails, they grow out in 6 months.
Yeah.
So the problem of it is once you get a fungus underneath your toenail, it'll take about 6 months to grow out. Well, you have an infection in your toenail, and it's hard to get medicine to it. And the medicine you take for toenail fungus is just really hard on the body. It's hard on the liver. It's hard on the kidneys. And but you have to take it for a prolonged period of time till it grows out. Especially if it's all the way underneath the nail, you are going to be on that medicine for 6 months.
Wow.
Yeah, and so you really have to be careful with that.
What about the lasers?
For what?
Your toenails, they have the laser toenail treatment that they can do.
I don't know anything about that.
Oh, Ron, I read some. I don't know a lot about it.
No, I don't know anything about
They can
laser.
treat it by lasering your toenails. If
Well-
you've got jacked up toenails.
But the only thing I know about toenails and fungus is the best way to take care of it is to remove the nail. It's not attached anyway, because the fungus has actually broken down the barrier between the skin underneath the nail that it's attached to and the nail itself, which is why they float. You consider it and wiggle them. Just remove the damn thing. And then you only really need to take antifungal medicine for about 2 weeks and you're cured.
That's
and
cool.
let the nail grow out.
Yeah.
But it will take about 6 months to grow out. The most important thing that causes nail fungus in the toenails is moisture.
Oh.
So people that wear a lot of sandals and flip-flops most of the time, they won't have a problem. But people have real sweaty feet that do not use what I call appropriate socks, real thick socks that pull the moisture away from the feet. And you can use talcum powder to help dry the feet while they're in a shoe that's non-breathable, like a leather boot.
Yeah.
That'll help a whole bunch.
Okay.
So I don't help with athlete's foot too. It's typically the same fungus that causes both.
Okay.
The name of it's called either trichophyton rubrum or mycosporidium. Those are the two funguses that cause this stuff.
Wow. Wreck your toenails up. I've seen some ratty looking toenails.
Oh, yeah, you do. And that's different than people in the nursing homes or when we get older, which is, you know, the thick toenails that get real deformed and everything. They can or cannot be fungal infections.
Yeah.
But what happens is the nails are growing a lot slower because there is no trauma. They're not wearing any shoes at all.
Oh.
And the nail, believe it or not, the nail matrix, the nail bed is actually more of a liquid than it is a solid. And so it builds up on top of itself, so it becomes very thick and distorted.
Oh.
So it's,
that's also why it's important to get out, walk around, put your shoes on, be active.
yeah, climb a tree, grab the nails
Yeah.
of a tree. Yeah,
Sounds like a real good thing for people in nursing homes.
absolutely.
Walk on a tree.
Yeah, get on that damn tree and climb that thing.
Guess what? Your activity today, we're gonna all get together and climb trees.
Take your shoes off, go climb a tree.
Okay.
But anyhow, that's the answer to your yellow nails.
Okay, well, that answers all our questions for the day. What do you think?
I don't know, but I hope this finger grows out soon.
Me too.
Yeah.
All right, guys, you have a great weekend. We will see you Monday for Mythbuster Monday.